Hi, hope everyone is well. I thought I'd do a update video. I have currently made myself a cup of tea. Baby is down in her activity centre bumbo seat thing. Probably call this a 5 months postpartum video. April turned 5 months on Monday. I can't believe how quickly it's gone already. I'm actually getting her weighed tomorrow, so I can't really update you on that. But this video is more postpartum for me. I might do a separate video on April's progress if anyone is interested. I know it's not really got anything to do about my channel, but if anyone is interested, because she has been through a few little things, for example, like being a very sicky baby, and she's been on a lot of different medications, but my side of things is still a work in progress. I thought I'd just update everything on how things are standing now. So just to recap, my pregnancy was overdue. I had to be induced in the end. I also had forceps delivery and an episiotomy. So the issue that I have is the episiotomy was quite a big cut. So obviously it took a long while to heal. I saw the doctors and the doctor said that, you know, your tear was, well, the cut was quite big. The gastro side of things has been okay. At the start, I noticed some bleeding from my stump, from my back passage, and which was quite normal for me anyway. I had bleeding before, and they just said I had a flare. This time, the difference that I noticed is that I didn't have a lot of control over it. So I'd go to the toilet, I'd go for a wee. Obviously, after pregnancy, I had to be very careful because it would sting because of the stitches. Then mucus / blood would just almost fall out. It didn't, I felt like I had no control over it, which wasn't what I was normally like. I could control it, and I don't know if anyone else has the same thing, but because I'm left with my stump, I still pass mucus, which they say is normal. Now, for me, it's almost like it builds up, and I have this sort of urge, oh, I need to go to the toilet, and I always call it my phantom poo, and I'll just go to the toilet as normal and I'll pass the mucus. Sometimes there can be pain and I'll feel like I need to constantly push, and that would then mean that I've got a flare, and it then would be blood alongside with the mucus. So the difference between after the pregnancy, like I said, I had no control over it. So for me, I was really worried that the episiotomy and the labour had caused some damage. So I'm now going through the process with my gastro doctor. I saw him a few weeks after because I was, like I said, I was a bit concerned. So I just had a chat with him, and he wanted me to have a colonoscopy. Obviously, it's not a colonoscopy for me because it's only just a stump, but he wants to take some biopsies, see if my colitis is flaring again. And he also wants to do like another camera to see if the muscles are okay, because he said like my muscles could be torn. And we did have the conversation that if my muscles have torn, that my reversal would be a no-go. At this point, I was a bit, I wouldn't say gutted, but I've always been like, what if? So because I've had that option that I can have my reversal, I'm always like, oh, what if? I really want to have it done. But I also did say to him, because he had it in his mind that I was really desperate to have it. Now, it's not that I'm happy with having a stoma bag. I'm going to be truthful. I do have really bad days, and I do really struggle having a bag. But then there's some days where I just don't even realise I've got it because I'm here, I feel well, I'm not poorly, I don't take as much medication as I used to. So that side of things I don't mind. So he said to me, well, if, you know, there is a tear in my back passage, then that would then mean very high risks of me being incontinent if I get joined up. And I said, if that is the case, I would not even bother having it. At the end of the day, I've got my beautiful little girl, and if that just means I've had to sacrifice that for my little girl being in this world, being healthy, then it doesn't really bother me. I think they're going to want to do the test anyway, just to make sure everything's okay and there's no real damage. So I'm supposed to be having a colonoscopy. Been trying to book me in for months now, and I keep cancelling my appointment and rescheduling it. Reason being is because I'm breastfeeding and I just don't want to leave her. The last colonoscopy that I had, my doctor took so many biopsies. I ended up having like 2 weeks off work. I had so much bleeding. I was so poorly. So I'm frightened that I'm going to get ill from it. And the fact that the whole process itself takes such a long time. It's not just half an hour in, I'll be out. It's not like that at all. So I feel like I know there's ways and means I can express milk and hand her over to someone, but I just don't want to. With my first pregnancy, I was in and out of hospital, and I didn't really get to have my daughter Sophie with me a lot. So for me to do this off my own back, I feel it just doesn't sit right with me. All the team up in endoscopy, they're really nice. They know me, so they've been really understanding. But I have got an appointment in February to see my gastro doctor, but I need to have the scope done beforehand. So I will either have my scope done in the next few weeks, if I have the courage to hand my daughter over to someone for a couple of hours. If not, I might have to push it back. I mean, I'm okay. There's nothing wrong with me. I'm happy. I'm fine at the moment. I haven't really had many bleeds. There's no major queries that I have. I do feel fine. So I don't feel like it's an emergency, whereas if there was something really wrong, obviously I would. Just very reluctant to leave April at the moment. I feel like, don't they call it mum guilt? I don't know, but I really just don't want to leave her. I may bring you along with me when I go have my endoscopy appointment. Obviously I can't really record a lot because of, other patients being there and confidential and things like that. If you have any questions about what a colonoscopy entails, I have had many colonoscopies when I had my colon after my operation, and obviously having them now. They're totally different because when I had my colon, I needed prep, but without my colon, I have no prep at all. So some people have sedation. I think I've had so many that I've just given up on having sedation because I know it's such a long-winded process if you do. It can be very, very painful, and it's not that I don't have it because I think I can't feel the pain. I feel it, and they've now started to offer gas and air in the last few years, so I've been having that. And because they're only seeing like so many centimetres of the rectal stump, it's not such a long-winded process, because when I had my colon it was a lot longer. They had to go further. It was a lot more uncomfortable. Postpartum with my stoma, when I was pregnant I obviously got very big and my stoma protruded, and obviously through previous videos that I done throughout my pregnancy I complained a lot about my bags not working, and my stoma stretched quite a lot as well. Sorry, I've got a grumpy girly. She wants to come sit with mummy. So yeah, my stoma stretched while I was pregnant, so I had to change a lot of my things. After pregnancy, my bump obviously went down quite a bit, and I did get a little bit worried. I didn't really notice things had changed till I had my first shower and I changed my bag. My stoma had protruded quite a lot. It looked quite long. I was slightly shocked because I wasn't expecting it, but I also was aware that, it's going to shrink and it's going to look a bit weird because it has been stretched. So my first worry was that has it prolapsed because of all the pushing that you do through labour. Obviously I did struggle throughout my labour, so there weren't a lot of heavy pushing, and I got a lot of help towards the end. To go see my stoma nurses, they had a look. Not only was my stoma stretched, obviously after like a week or so of having her, my belly, like the skin was really loose. When I'm sticking my bag on, it's because of the type of stoma bag that I have, it's very thin, it's like a wafer, so it really, really sticks to the skin. And when I take it off, I literally feel like I'm pulling my skin off with it, because like I say, my skin's quite loose at the moment. It really hangs on tight to that skin when you're pulling it off. Maybe it's just the type of bag that I have that does that. I mean, I haven't changed my bag. I'm still using the same one. I have changed the cut-in size of the Stoma because it has shrunk back down. So being 5 months postpartum, my Stoma hasn't changed a lot. Pretty much looks exactly the same as it was before. Like I say, that it shrunk back down to a similar size from what it was to start with. I'm using the same bag I used throughout the pregnancy. I have also dabbled back into the same bags I had previously. The only reason why I'm really using the ones I had through pregnancy is because they're bigger, and obviously I don't have to empty it as much, and they seem a little bit more comfortable. I did, to start with, for the first few months, notice that my belly was obviously still changing shape. So I did have a couple of leakages, or it didn't last as long as it would normally. But as it stands now, I seem to be coming back to normal. Has taken a little longer than I thought it would. My belly still needs a lot of work. I'm grateful that I've had no scars and I didn't have a C-section. Because I was so big being pregnant, obviously I stretched out quite a lot, and unfortunately I've got loose skin, but that's what you get when you have children. I'm also quite lucky that I've lost quite a lot of weight. A lot of people putting it down to the fact that I'm breastfeeding. I'm also exclusively breastfeeding. It has gone so well. I cannot even, it has gone so well. I'm so happy. I have had no real problems, apart from the fact that because I suffer with eczema, I get eczema on my nipples, and it gets to the point where I just want to rip them off. They are so itchy and so sore. I can't use lanolin cream because I'm allergic to it. So there's not really much things that I can use, and obviously I have to wipe them off before every feed. So that's gone really well. So my weight, I was roughly 10 stone 4 before I was pregnant, and I weighed myself the other day, and I'm now 9 pounds, and I'm now 9 stone 6. So in my mind, I think that's fabulous, because I haven't actually done anything. I haven't really been watching what I eat, especially over the Christmas period. I'm not a big watch my weight person anyway. I just eat what I think's right. I make sure I eat regular. I've been drinking a lot because I seem to be so thirsty, which they say is normal as well. Breastfeeding has, for me, had lots of pros for doing it. I have saved myself so much money because I haven't had to buy formula. I haven't had to use bottles. It has just been so easy. My first pregnancy, I did formula feed, and to compare the difference, it's just, breastfeeding is so much more convenient. It was difficult to start with, to obviously breastfeed her in public and try to do it without everyone seeing your boobs. So that became tricky for me. But I've just sort of got the knack of it. You get the right clothing. You can still wear the same things. I remember speaking to some girl, they said they stopped breastfeeding because they couldn't wear what they wanted, and people would see their fat rolls on their side. And I'm like, there's always ways around it. And I've not bought any different clothing. I just bought some different clip-on bras, which were cheap enough. And it has just been such a breeze. I've not really had many issues, which, thank God that it has been easy, because I know some people really struggle with latching on, with their milk production. I've just had such a lovely time. I've really, really enjoyed it, and I'm just hoping that she's getting everything that she needs. I will, like I say, I'll have to do a separate video to explain how she's been getting on, because there has been a few ups and downs. But I've absolutely loved breastfeeding her. I'm so glad that I was able to as well, and hopefully she'll reap all the benefits of being a breastfed baby. So overall, I'm feeling great. It's really strange. The only reason why I find it weird is because I compare it to my first pregnancy, and they are just totally different in all aspects, whether it's the labour, the aftercare. it's just totally different, and I feel really good, and I'm very, very happy. Everything is going really well. Sophie absolutely adores her little sister. She's been such a help. The age gap has worked wonders because she helps out quite a lot around the house. Me, I'm just enjoying being off work, enjoying my little baby, and you know, I want to update you on what's been going on. Like I always say, please leave me some comments. I really like hearing people put little messages just to let me know what they're thinking or what they're going through, and it just makes me feel like if I'm helping that one person, then makes me feel like I've done my job for the day, done my good deed for the day. So please leave me a comment, talk to me, ask me anything you like, or even just having a little chat. I think that covers everything. If I've missed anything out, like I say, please comment. And hope you all have had a lovely Christmas and Happy New Year to everyone. Bye.